Come in. Hi, Miss Jones. How are you today?
I'm fine.
Great. My name is Celebrity McNeil. How are you?
Good. How are you doing?
Great. Thank you for asking. I'm a family nurse practitioner student, and today I'd like to perform the respiratory assessment on you. Do I have consent to begin?
Yes.
Perfect. Thank you. Any concerns regarding your respiratory, breathing-wise, any pain, breathing in, out, anything of that sort?
No.
History of asthma, anything of that sort?
No.
No? Okay. All right, we'll begin. First thing I'm going to do is I'm going to go ahead and just breathe normally for me. Take a deep breath in through your nose and out your mouth. And you can go ahead and just breathe normally. Okay, I'm going to go ahead and press here and tell me if you feel any pain at all. Any pain as you're breathing in and out?
No.
No? Okay. It's feeling symmetrical. I'm going to do the same thing in the back. Okay. Any pain here as you're breathing in and out?
No.
Okay. It's looking symmetrical on both sides. Breaths look even and non-labored. Okay, I'm going to, I'm just going to put it over here. Just continue to breathe in and out. Okay. Now I'm going to be placing my hand on your chest. Go ahead and say 99 each time you feel my hand on your chest, okay?
Okay.
Okay, go ahead.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Go ahead and listen to your lung sounds, okay?
Okay.
Okay, and each time you feel my stethoscope on your chest, just take a big breath in and out. Go ahead. Right under your breast. Go ahead. Side, go ahead. Make sure I hear those lung bases. Okay, very good. I'm going to listen to the back of your lungs. Okay, breathe in and out. Breathe in and out for me. Just get the base of the lungs. Okay. Very good. I did not note any labored breathing at all. I didn't hear any wheezing or any bronchi, any of that sort. You never had a history of pneumonia or anything of that sort.
No.
Okay, I'm just gonna do one final test, and I'm just listening for the resonance to see if there's any fluid or air, anything of that sort. Okay, so I'm gonna start in the front. Okay, and I'm just gonna percuss a little bit. Any pain at all?
No.
Do under your breast area. Base of the lungs. Okay. Do the same thing on the back. questions at all for me?
No.
Okay, well, I did take a look at your, I assessed your breathing patterns, no abnormalities noted. I did check here, it seems angle of Louis, I did check, let's see, the substernal notch didn't seem abnormal at all, so. Well, I think at this time, this concludes the respiratory assessment. Any questions for me, any concerns?
No.
Thank you, have a great day.
Thank you.
Thank you.